Okay, let's jump right into this explainer and demystify canine chronic kidney disease. Look, if you've recently gotten a diagnosis for your dog, you're probably swimming in a sea of confusing veterinary jargon right now. Well, take a deep breath. We're going to translate those complex clinical terms into clear, actionable steps for your best friend's health. We'll break down exactly what's going on in their body and, way more importantly, what you can actually do about it.
Here's our quick agenda for today. First, understanding canine kidney disease. Second, diagnosing and staging CKD. Third, the power of diet. Fourth, top vet-recommended foods. And finally, long-term and palliative care.
Section 1. Understanding Canine Kidney Disease. So, we have to start with the reality of chronic kidney disease, or CKD. I'll be totally upfront here. This is an irreversible, progressive deterioration of kidney function. But, and this is a big but, irreversible does not mean unmanageable. Think about the stark physical difference between a healthy, smooth stage 1 kidney and the severe, kind of bumpy deterioration you see by stage 4. That drastic physical change is exactly why proactive management is so absolutely critical. The more healthy tissue we can preserve early on, the better your dog's quality of life is going to be.
As the kidney deteriorates and loses that smooth, healthy function, it really struggles to do its main job, which is filtering waste. This leads to something called uremia. Basically, it's a toxic buildup of waste products right in the bloodstream. If your senior dog is dealing with severe lethargy, unexplained weight loss, or if they're suddenly turning their nose up at their absolute favorite treats, yeah, uremia is usually the culprit. It literally makes them feel nauseous and sick to their stomach.
Moving on to Section 2, diagnosing and staging CKD.
You know, you can't fight an enemy if you don't know its size and strength. So it's crucial to understand exactly how your vet figures out which stage your dog is in. They build a complete diagnostic picture step by step. First, they evaluate clinical science, things you'd probably notice at home, like your dog constantly drinking the water bowl dry or needing way more bathroom breaks. Next up is a physical exam to check for things like dehydration or palpable kidney issues. And finally, they run specialized blood and urine tests. They're looking specifically at markers like creatinine, SDMA, and whether the dog's urine-specific gravity has dropped below 1.030.
And here is how all that testing comes together. The International Renal Interest Society, or IRIS, has staging criteria that translates scary medical terms like azotemia, which really just means elevated blood waste, into clear, quantifiable numbers. For example, if your dog's SDMA is between 18 and 35, and their creatinine is between 1.4 and 2.8, boom, they're in stage 2. This exact framework is the game changer that allows your vet to tailor a specific, targeted treatment plan just for your pup.
So, once you have that stage, knowing that CKD is irreversible, the natural question literally every pet owner asks is, how in the world do we slow this progression down? How do we give our dogs more time? What can we actually do today?
Which brings us to Section 3, the power of diet. The answer actually lies in the elements you can control right in your own kitchen. While medications are definitely important, nutritional therapy is the absolute cornerstone of CKD management. You have incredible power to support your dog just by changing what goes into their bowl. Think of phosphorus as the villain here. It accelerates kidney damage by forming crystals and putting severe strain on those failing kidneys. On the flip side, highly digestible, premium protein, we're talking egg whites or lean fish, is the hero. It maintains your dog's muscle mass and energy, but produces way fewer nitrogenous waste products than lower quality proteins or red meat. It perfectly balances their energy needs without overwhelming their compromised filtration system.
And looking at the official veterinary treatment pathway, introducing a renal therapeutic diet is actually the very first proactive intervention recommended the literal moment a dog enters stage 2. It is not a last resort, guys. It's your frontline defense.
Section 4. Top vet-recommended foods.
All right, so we know the theory. Let's dive into tangible solutions. To give you an idea of how critical this is, low-phosphorus dog food now dominates with a massive 60% market share in the entire canine renal diet space. That just proves how standard, trusted, and incredibly effective this specific dietary treatment has become worldwide.
But here's the catch. CKD severely reduces a dog's appetite because of that nausea we talked about earlier. Getting a nauseous dog to eat is half the battle, right? So your options really depend on palatability. Royal Canin leads the pack with an amazing 95% acceptance rate, mostly thanks to its strong aromatic fish profile, which is absolutely perfect for dogs whose sense of smell is kind of fading. Meanwhile,
Hill's Prescription KD is fantastic for ultra-low phosphorus needs and has a savory chicken flavor. And hey, if your dog has severe allergies alongside CKD, Rain Nutrition uses novel proteins like kangaroo. Basically, there's an option out there for even the pickiest eater.
And these diets aren't just theoretical. Clinical data shows that dogs on these formulas see incredible, real-world benefits. The added omega-3s actively curb kidney inflammation, and capping sodium under 0.3% prevents blood pressure spikes. The evidence is amazing. Real users report things like a 12-year-old lab seeing a 20% drop in creatinine levels over 6 months on Hill's KD, or a golden retriever gaining back 15% of their body weight just by switching to Royal Canin. Food is quite literally medicine here.
Finally, Section 5. Long-term and palliative care.
Let's look at the long-term journey, because managing CKD isn't a set-it-and-forget-it kind of deal. It takes ongoing dedication to preserve your dog's comfort. The absolute key here is strict, consistent monitoring. You really need to be tracking their weight every single week. Even a 5 to 10% drop is a huge early warning sign of underfeeding. You'll also work with your vet to do quarterly blood work, keeping a close eye on boon levels and making sure that dangerous phosphorus stays under 4.5 milligrams per deciliter. Make absolutely sure they have constant access to fresh water to monitor hydration and stop crystal formation. And, don't be afraid to rotate those food flavors we just talked about if you notice their appetite's starting to dip.
We'll wrap up this explainer with this final thought. Getting a chronic kidney disease diagnosis is undeniably scary, for sure. But by understanding the staging process, working hand in hand with your vet, and utilizing these incredibly specific dietary tools, you are performing the ultimate act of love. You literally have the power to extend their median survival by 6 to 12 months and fill that time with a beautiful, comfortable quality of life. So, knowing the incredible power of nutritional therapy, what's the first change you're going to make to your dog's bowl today to give them a better tomorrow?